Hello, welcome back. It is freezing cold in Canada right now,
Yeah,
in
polar vortex in
specifically.
Ontario the last 2 weeks.
Oh my God. And it's just like bone chillingly frigid. And I don't know about you, but I don't do very well when that is the case.
No, 100%. It's tough too because I'm fostering a dog right now who's a German Shepherd, and she loves it. She's like made
Mm,
for this, right?
yeah.
So I have this like internal guilt, right? Because for those that don't know me as a human, it's myself. I'm a single mom to a 4 almost 5 year old, and then I foster puppers. So like it's an event in my
Yeah.
house, right? A lot of these dogs, they're not like amazing on a leash, and they're learning. And then on top of that, I've got to bundle my son, and it's like it's a whole event, and I just can't like wrap my brain around going outside. It's also dark. It's dark really early this time of year, so it's dark, it's freezing, it's a whole thing.
It's crazy because so yesterday, we were on our way back from Brampton actually, because we stayed over for a wedding. And yesterday was a really beautifully sunny day. And when I tell you, my mood was like
Oh my,
on a
summer,
different planet.
all the difference.
Like I woke up, I was like, and we were in the hotel and I like opened up the blinds, bright, sunny sky. I was like, and I didn't get much sleep because I don't sleep well in hotels. I don't know about you. I don't sleep well in hotels.
I don't like sleeping
I
anywhere that's not my house, to be honest.
Yeah, and I don't feel well, okay, in fairness, if I was like sleeping at your house, I probably would sleep fine. When I'm at a hotel, I go down, okay, I follow a lot of like safety accounts on TikTok,
I feel
and
like
I
we
go down like rabbit holes of like kidnapping and sex trafficking, and it
can't sleep.
it's a dark place. You okay, you want to know what I did? So my husband's already sleeping and I'm up. I'm awake. I'm like creeping around, okay? I'm I'm trying to remember because okay, let's just rewind a little bit. When I used to live in a condo, it freaked me out to know, and I might be the only one here, but it freaked me out to know that someone other than me and my husband had a master key to my home, right? Because it's a condo, right? So in the condo, the management has to have a master key to everyone.
I've lived in condo, and you know what? Not once did I consider this, but go on.
Yeah, it's something I thought about every single day to the point. And if you know me, you're like, yeah, makes sense.
Right.
Makes sense. My
That's
mom's listening, like, yep, I know. Um, Not only do I get freaked out, okay, I have to, you know what? Maybe I need to tell this. It's time for me to tell this story. I have an irrational fear of dying from carbon monoxide poisoning.
okay. This I
And
didn't know.
yeah, I have to the point where I've lived. So in my third year at University of Guelph, I realized we didn't first. I don't know how it came up, but we didn't have a carbon monoxide detector. When I tell you, and my best friend to this day, like, will bring this up because she lived with me at the time. I literally cracked my window open, and I was like, essentially, my head was like out the window in the middle of winter.
High of exposure, but the air will be clean.
So I could have oxygen come in just in case. And then the next
Right.
night, I couldn't do that again because I was freezing cold. I actually went over to my friend's house who has a detector. I slept at her house that night. Okay, so that's my base. Like, just I feel like everybody needed context for my baseline level of crazy, right?
Right.
So I'm at this hotel and I'm thinking, so if I guess going back to my condo, I actually bought this thing off Amazon. And like actually real talk, serious, if you're looking for a lock, like a portable lock, this is it. Okay? It's like $10 on Amazon. It goes in the door, like when you open the door, it goes in the what's the pokey outy thing that like goes into the hole, you know?
No, I'm a chiropractor.
Anyways, whatever. The not a door installer. Hey, the little knob that like when you turn the handle, it goes bloop and like goes into the hole. So, anyways, this thing goes over it. You shut the door, you put the thing in, you put it down, and it makes it so that if someone were to open the door, they cannot open it. It like blocks it. So when I go to hotels, I would bring that with me to like put in the door so that I could be essentially safe. But since I moved to my house, I don't use that lock anymore for obvious reasons. And so I don't know where it is. So I was looking for this lock so I could bring it to our hotel stay. I couldn't find it. So I'm freaking out.
like a deadbolt too in hotels, or no? Those hotels I'm staying at, these don't sound like very nice hotels.
I was at the Courtyard Marriott. So
They
like
don't
it
have
was nice.
deadbolts there. That's a
No,
negative.
it does. No, it does.
But
But
that's
if
not
you
good
start,
sense.
okay, I'm telling you right now, go on TikTok, everybody. After this, you listen to this episode because it's a good episode. But I want you guys to go on TikTok and I want you to search hotel room break-in, and you will see a ton of different flight attendant accounts that are going over what happens. And essentially what happens is, if you're watching this on video, you'll see me visualizing it. If you're listening, just like picture it. Okay, so your door's locked, you got a deadbolt, you got a latch. They can, first of all, if they get the universal key, the card, they're in. Beep, they're in. If you have the latch on, literally they just have to take a hanger or like a bolt cutter and cut. They open the door and they just cut. They can open it. Okay, so there's context.
Bolt cutter though, I feel like I would hear a bolt cutter and then just like come at them, you know?
Not fast. Well, you know what? Okay, this is the difference.
I knew the story we were going to
This is the difference between me and Ashley. Okay, I am flight, and Ashley is fight. Okay.
So I actively, just to jump off of Laura, I actually actively disrupted a break and entering to my own house this year, and I just like went after the guy. So this isn't smart. I actually wouldn't recommend this at all. I don't know why. I just don't have this like, I don't know, just this passion for my.
You don't have an internal stopper.
No, I don't. I'm just like I'm a get 'em. But yeah, so I noticed that there was a creepy blacked out car across the street with two individuals in it laying down flat, watching my every move, going into my car, and I was like, well, that's suspicious. So I get my son buckled in, and he's all safe and stuff like that. Get him to daycare, and when I get back, I notice that they're still there, and I'm like, they're like eyeing up my house. They're like coming for it, you know. This was like in the morning too, by the way. So I was like, something inside me, I was like, okay, Bennett's safe. I'm going to do a loop. I'm just going to loop around the subdivision and like sneak on back. So I like pulled up in behind them, their car, as they're like walking up to my house, like prepared to break in. And I like hollered out at them, like basically like, hey, what do you want? Like, I don't have any money type thing. And it was just enough to, I don't know, like kind of spook them. And then they ran into the car and took off. Now, where I failed in all of this was, well, debatably a couple ways, but
yeah, debatably,
like, I don't know, just I really didn't have anything though, to be honest. I was giving them a heads up, like there's really nothing of value in this house. But
I have nothing of value. I'm a chiropractor.
I have nothing of value. Really old TV, no electronics. Like I really can't. My computer was with me. Like I've got nothing. Like there's nothing in here worth anything. Not worth your time. And my precious cargo was at daycare, right? So I was like, I got nothing to lose, I guess. Yeah, I didn't take the license plate, and they just like took off, right? I should have taken the license plate, but I didn't. But I did actively break up a break and entering, and I have all of my valueless belongings still here.
So I guess this security conversation is not one for Ashley, because Ashley would fight the person
with a bat. I would have chased them with a bat. I would go to a hotel and just bring an aluminum baseball bat and be like, I've got this.
Okay, so my contraption that I found on TikTok, okay, if you can just picture it, you take a hanger, the hangers that come in the closet, and you attach the bottom, like the big loop of the hanger, you attach it in the handle, okay? So now you have a hanger that part of it's in the handle. Then you take another hanger, you hook it on the hook, like the latch, and then you essentially attach the two hangers. So you're putting the hanger through the hanger and attaching it on the loop. So now you have like two hangers hanging.
Oh my God. I think you're just going to have to link this to the show notes, because now it's just such a visual.
Yeah. So anyways, how do we get on that? It is
I don't even know. Weather in Canada sucks. Speaking of sunshine, lack thereof. You know, there's a big trend. I'm seeing this a lot in the fitness world, and in fact, a lot of people I really admire doing it. But I'm going to go against the grain. I'm going to tell you what I will never do, no matter how much you pay me, no matter what the benefits. Cold plunges.
Controversial.
funny enough, in all transparency, so it is our job as clinicians to be objective about our recommendations, right? So I see people do these cold plunges, and I was like, I hate being cold. I hate being cold. I'm the person that has the shower at the temperature that like scalds my back. Love it that way, and I just refuse to be cold and uncomfortable. And then I thought to myself, I'm actually going to take it. Of course, all the people that are like deep into this are spouting all the benefits. And, I took a step back and I was like, I'm going to do some research into this, look at some meta-analysis and see if there's actually some research behind it. And guys, there is. There is, and it's generally quite favorable.
And you still won't do it.
Still won't do it. I would rather, people that go to the gym with me, I have like a gym crew. We're like a mixed matched, just a group of people that probably would have never have met otherwise. And I've told them I'll just die a couple years early. Honestly, they're probably the years that I was going to be putting my lipstick on outside of my lip lines. Like they probably weren't going to be good years anyway. So like, just let me go and let me stay warm. Anyway, so we're going to dive into that a little bit. For anybody that's maybe on the fence, if you're like me and you're like, bro, I'm good, I'll pick up some other health habits, great. For those that are on the fence, I want to give you some information. So I looked at one study, a review of 104 studies, which is pretty good. This is a 2022 article, so relatively recent. And guys, I hate to say it, but generally pretty favorable health benefits. Most notably, there was, pretty strong association with reduction and or transformation of body adipose tissue, meaning fat. So really good at reducing overall fat stores, which is really interesting because when you look into the implications behind that, there's a protective effect against things like diabetes and cardiovascular disease. So they go into the article, maybe we should link the article as well, going into sort of some of the explanation behind the benefits, but I thought that'd be a bit aggressive for today. But yeah, seems to be some benefits in adipose or fat tissue and generally positive effects on the immune system, especially when it comes to tolerance to stress and respiratory infections. So
interesting.
That's pretty interesting too. I don't know, because when I think of this overall event or intervention, it seems like a body stress to me. And maybe that's a part of it, being plunged into ice cold water. But kind of circling back, whenever you look at research, you kind of want to look into, the methods, how strong the articles are. And what we will say is that although these results do look quite favorable, they were carried out in very small groups.
That's what my question was going to be.
Small groups, quite small studies, often of one gender. Pretty much all of these were run on males, and we know that the female and the male body is not the exact same, right?
Yeah.
With differences in cold exposure temperature and salt composition in the water, right? So
I didn't think about that.
Correct. Neither did I. I was like, oh, salt water, that's different, right? Something that we might want to control for in the future. And again, how cold is cold, right? Like, where's the threshold? Like, if I could get the same effects in, lukewarm water or something compared to scalding hot, maybe we would, give that a go. But, how cold is cold? How cold do we need for therapeutic benefits? We don't really know.
What was the baseline health status of these people? Do you know?
Very good question. Very good question. Not a lot of control. And in fact, that was something I was going to talk about. So in general, the few studies that did look at some of those other health factors and also psychological status. So a lot of these people had a very positive mindset in general. And in a lot of these studies, they were following their cold therapy after some degree of physical activity.
Yeah.
Right? So, we have to look at, we know so much research to support the general benefits of being physically active, right?
Yeah.
And then if we throw those buggers in some cold, what can we delineate from what intervention, right?
Well, but then also we know that, for example, football players in a high intensity sport do ice baths after a physical
Correct.
activity. We know that to help reduce acute inflammation and help with recovery.
Right.
But I'm wondering, I pulled up a CBC article that we can chat about after, but it is people who are not doing any sort of physical activity who are doing a January 1st cold plunge.
Right. Right. And I would debate, although it would seem that, cold plunge would have some additional health benefits, you will pretty much never see me or hear me. And in fact, this is a hill I'll die on. I'll probably always start with an exercise based intervention over throwing you in Lake Simcoe for the health benefits, right? So
Yeah.
it's a matter of, where's maybe our best starting point, best bang for our buck, so to speak, in terms of health benefits, really.
Yeah.
Any
Well,
thoughts?
even in this article, they're looking at people with cardiovascular issues, poor circulation, because we know it increases the heart rate and blood pressure and makes the blood vessels shrink and the muscles constrict. So they're saying if you're sedentary, which I don't know about you, but I've seen the cold plunges, downtown at the water, and not everybody is in tip top shape.
Correct.
Again, not that you have to be in tip top shape to do this, but are you, any sort of routine physical activity person? Do you have existing risk factors, and are you considering that, or just have you heard that cold plunges are good for you, so then you're now doing them?
Right. Yeah, absolutely. Something to definitely consider. I can tell you for free, I'm just gonna die earlier and be warm.
Well, and we also know, again, factually, that women are likely to die from heart disease. We also know factually that high blood pressure is a silent killer. And so, again, a lot of these people, it's like the age old conversation that you have with a patient. Like, do you have any, a big thing I say is, do you have any conditions diagnosed by a doctor? And they'll say no. And then I say, when was the last time you saw a doctor? And if the answer is 15 years, then potentially you have a condition that you don't know about.
Potentially, because you haven't had that follow up, right?
Yeah. So I think, looking at cold plunges, we have to, like any intervention, we have to look at the risks, look at the benefits, look at your baseline status, because someone who, runs marathons or somebody who just like yourself, maybe you don't like cold plunges, but you would be a fine candidate to do them from a health perspective,
Correct.
right?
Yes.
Someone who, strength trains very consistently, young, no other conditions, like good health, no medications. Like, what's your baseline, right? Just because something is generally
Yeah,
okay.
and that's been kind of my debate because the only people I know that are participating in this particular intervention are actually quite fit people.
Yeah.
And I'm not super worried about how their body is going to adapt to that particular stressor. And that's really the only population I've seen actively do it. So, really curious. About the research behind it, but turns out also from a research based perspective, they're also looking at very similar populations, right? And one of the other things I don't think I touched on is, and this was spoken about as some of the limitations of the study, in that a lot of the times, yeah, this is following up exercise and it versus just as a standalone intervention, right? So we have to take that into account.
Absolutely. Okay, switching gears completely. In our Ask Reddit segment, we are chatting about yeast infections. And the blurb that I read on Reddit, the question that was asked is, this person who's getting random yeast infections after intercourse with their boyfriend, and their question is, did he cheat? And so I thought this was a really good topic to bring up because it shows me how little the general population knows about yeast infections and, the complexity of it. So
Right.
I think first and foremost, it's important to understand if we're looking at the microbiome, we're looking at, gut health and vaginal health. The microbiome essentially is bugs that we have everywhere, from our skin to our mouth to our butt to our vagina, like all the things we have bugs everywhere. That's the microbiome. And when we look at this specific microbiome that has to be in the vagina and the uterus, it's going to be different and distinct to what we're going to find in the gut. And so in the vagina and the uterus, predominantly we want lactobacillus bugs. And essentially, when those are not there, we have other things that are going to have an opportunity to grow given their opportunistic nature. So things like candida will grow and create what's known as a yeast infection. The yeast infection is going to be an overgrowth of candida. This is what you're going to typically see, that like, white, curdy type of discharge. And it's usually going to, be itchy. It might be irritating, or you might be irritated. And you don't necessarily have to have a ton of discharge in order for it to be a yeast infection. We're looking for usually redness, usually discomfort. Anything that feels uncomfortable is going to be, something we want to look at. And the question is, why am I getting yeast infections after intercourse? And does that mean that I have a yeast infection? And the answer, does that mean I have an STI, or my partner is cheating? The answer is no, not necessarily. Essentially what happens, and what I see happen with partners specifically, if we're not using protection, what can happen is, if you have an overgrowth of yeast, you can, have intercourse with your partner. Let's say you're not using any sort of condom or barrier protection. You have intercourse, your partner's probably going to get some of that yeast in their microbiome. And what ends up happening, especially what I see in patients who have recurrent yeast infections, specifically with the same partner, is that this yeast has been reintroduced after you've kind of gotten rid of it. So your partner essentially may need to be treated as well in that circumstance. So a lot of the times I'm speaking to a patient and they're saying, well, I get it. I have to take Canestin every single month. I'm, having to do, I have intercourse, I get a yeast infection, I have to take Canestin, and then it happens all again the next time. And essentially we see some associations. Some of the associations we see frequently are yeast infections associated with the time you're at in your cycle. So, people after getting their period may be more prone to having a yeast infection. Sometimes it's, after intercourse. Sometimes it's a combination of the two things. And so we need to look at, any sort of recurrent yeast infections. We should look at that as a microbiome issue. And then we have to figure out what's disrupting the microbiome. So in this case, for sure, your boyfriend could be cheating if you have recurrent yeast infections, but more likely
that's probably not it.
No, more likely it's probably that you have a sensitivity to microbiome disturbances, and that we need to look at it from that perspective. Why does yeast always have the opportunity to grow in your environment, right? And so one of the examples I like to give is with birth control, such as the NuvaRing. So in my personal experience, I was on the NuvaRing for a while. And if for anyone who doesn't know, the NuvaRing is like a silicone bendy circle. And the way the birth control works is similar to the pill. You're 3 weeks on, 1 week off with that withdrawal bleed. And essentially you're taking that and you're inserting it up high into the vaginal canal. You leave it in the whole 3 weeks. You take it out 1 week. That's when you have your withdrawal bleed, or your period, quote unquote. And then essentially you do it all over. When I was on it, I had recurrent yeast infections no matter what. And I had, at the time, I was young. I wasn't in school yet for naturopathic medicine. Went to my family doctor, said, hey, wondering if, these yeast infections have anything to do with my birth control. What do you think? Doctor said, no, your problem, not birth control. I said, okay. Went home, did the whole anti-candida diet and, removed all the vinegars in my life and removed all the sugar, including fruit, got rid of bread. I was like, this is not helping. And essentially, it was because the NuvaRing itself was disrupting the microbiome, which now, in practice for over 6 years, I'm like, that's obvious. But when I was, whatever age, early 20s, my doctor said it wasn't causing it. And I said, yeah, I guess you're right.
A lot of people don't think to directly question their healthcare providers, right? Like, you think, well, they know the things, and
totally.
I asked the question, right? And when you get a firm no, you're like, oh, okay, I guess that's that.
Yeah. And so we need to make sure that we're looking at, like I said, yeast infections need to be looked at like a microbiome disturbance. And so we need to look at it. We can also associate gut issues. Like if you have also IBS, or you're really sensitive to certain foods or anything of that nature, it's worth considering looking at that connection between your gut microbiome and your vaginal microbiome. And I told Dr. Ashley that I feel thongs are E. coli tightrope.
This is stuck in my head forever. It makes, because I mean, not that anybody needs to know, but I primarily wear thongs, and she was like, an E. coli tightrope between your vagina and your butthole. And I was like, wow,
Yeah.
such a visual. And I mean, naturally, I changed nothing about the underwear I wear, really, except, um, except the one that Dr. Laura gave me. So the other week, Dr. Laura went shopping for whatever reason. She's allowed, and I guess she didn't buy the right size, and she's like, "Hey, do you want like a random pair of underwear that doesn't fit me?" And if you know, like I'm like a super cheap person that like picks up random stuff on the side of the road. So I was like,
Not
yeah.
underwear.
Well, no, not underwear, no, but like sandboxes and other. Yeah, you know what? Let's not start rumors.
Yeah.
In the city that we practice, I do not pick up random pairs of underwear on the side of the road. Okay,
Okay. What happened was I went to buy underwear and I now am at a size large, which is like such an annoying thing for me to deal with. But
it's very arbitrary, but we can circle back.
I'm over it. Anyways, I grabbed a group of underwear that I'm like, these are the ones. And they were all the same size, except I had one rogue medium. And I'm like, oh, this is not going to
Like
fit
it
me.
jumped in there on its own.
Like, literally, it did. For sure it did. And so I just told Ashley, I'm like, listen, you want this? But it's not a thong because I personally don't purchase thongs. I can't take credit for the E. coli tightrope. I did learn it. One of my mentors, she said it. And again, stuck with me. Love it. But I think that that's something to consider. If there's recurrent yeast infections, what sort of underwear are you wearing? If it's a thong, is it a breathable? Is it cotton? Right? Like we at least want to make sure it has a cotton crotch. And so again, looking at helping the gut overall, making sure, we're not just using Canestin every single month. We need to look at why this is happening. And most times I don't find it to be corrected by these really restrictive, like candida diets or whatever else we're finding, like remove all vinegar and take away all vegetables and fruit.
No,
Well,
now
not
you're just going to be
vegetables.
saddened with a yeast infection.
Yeah. So again, I guess in conclusion, it's not an STI. It's not a sexually transmitted infection. And essentially, I was telling the audience when Dr. Ashley was getting her cord that essentially we can pass it back and forth between partners. So. So we need to make sure that if that's the case, potentially treating both partners is something that I've done as well. So using the cream as well, because topically, it can be really, really helpful. So that's that on that. All right. Well, thanks for joining us, guys, and see you next time.
Yep. That's a funny one.